With no further delay, let's get started with the introductions. Sharif, could you please introduce yourself? And then we'll go to you, Logan.
Glad to. So I'm going to actually move to the next slide because you've got the pictures for both of us. So I've been in ophthalmology for many, many years. I've known Logan for well over a decade, and I've served in industry roles as an executive back in the days of Visex when they were launching. I've been a consultant to numerous manufacturers and doctors. And as Dr. Matosian said, I authored a book called Beyond Bedside Manner, and that book has now become a training program called PX90. And I can't say it's in my spare time, but a good chunk of my time is spent also running the practice, the Laser Eye Center of Silicon Valley. We're a pure refractive practice here in the Bay Area of Northern California. And among all that, and my family life keeps me plenty busy. Logan.
Yes, as Sharif said, it's been over a decade of working with Sharif and others in ophthalmology and specialty healthcare more broadly. And I've worked in an agency environment as a partner. I've worked as a business consultant and a human-centered design consultant into a practice doing their marketing and outreach to the referral network. Now a director of marketing, speaking, authoring, and the through line through all of it has been this idea of experience design, the importance of the experience. So for about the last year, I've been with Promptly because of this idea of focusing on what it means to build a consistent and excellent experience. And on a personal note, you probably can't see it here, but this is my son right here, graduated from junior year of high school today. So on a personal note, today was the last day of school for him. And you probably can't see him very well, but there he is. So it's the last day of school around here, a lot of excitement.
Congratulations, Logan. That's a big
Yes.
milestone for your son.
Makes him feel old. Yeah.
Go ahead. No, that's great. So Sharif, let's get started.
Yeah. And so we intentionally titled this "Stop Talking, Start Doing" because, I think most of the practices that I encounter say, "Oh, we believe that customer service is important, and we believe that patient experience matters," but very few are doing it well. And here's the problem, illustrated through this slide. There was a survey done by Bain and Company of CEOs of over 300 companies, and they were asked, how would you rate your customer service? And 80% of them rated it as excellent. Bain then went and talked to over 3,000 customers of those same companies and asked, how would you rate the company's customer service? And only 8% rated it as excellent. And what we have here is a gap between how good we think we are and how good our patients, who are also our customers in a patient experience mindset, how they evaluate us. And this gap shows up in different ways. And one of the ways it shows up is in how we get reviewed, healthcare in general. I'm not saying that you have a 1-star average review, but many practices do. And I see it on the internet all day long because we are failing as a profession to meet the needs and expectations that patients have for the customer part of the equation. Maybe not for the clinical part or the surgical part, but certainly for the customer part. And what ends up happening is you see reviews like this one where people just say, hey, this was just not what it should have been. And they're reviewing medical practices in the same way they review every other purchase consideration and decision in their lives. We are not immune to this, and we have an opportunity to address it. And the reason we want to do it is through the next few slides. First of all, this one shows a stock fund called the ACSI. It's an exchange traded fund. You can buy this fund. This fund invests in the 30 to 40 companies across those 30 to 40 industries, which lead their industry in terms of customer satisfaction. So they're focused on making customer service and customer experience as good as it can be. And what you see here over a nearly 20-year period is if you had invested in the S&P 500 index stock, you would have had a nice return, 587%. But if you had invested in this tracking stock, you would have crushed it much, much higher. And that is the difference. That is the value that Wall Street places on companies that invest in the customer experience. And so, what does this mean to us? Let's first look at it as consumers and something that we do every day. And that is, most of us drink a cup of coffee. So let's look at now what's called the progression of economic value. This comes from a book called The Experience Economy that Logan Wang and I have worked with the authors. We're very comfortable with and familiar with this material, but it talks about how our economy has evolved over the last 150 years from one that was based on commodities. That was the farming, if you would. We were an agricultural economy, and a cup of coffee at the commodity levels worth about 5 to 10 cents. But if you take that cup of coffee and you now process it, you process that commodity into a packaged good that could be sold at a store, the value of that cup of coffee goes up tremendously, 2.5 times to a quarter. Now, if you then take that cup of coffee and you elevate it from a packaged good into a service, you go to a local deli, you go to any place to buy a cup of coffee, you're going to pay $1 or $2, but that's a huge elevation in value. And we are paying for the activity of someone brewing, pouring, and handing us that coffee across the counter. And then we all know what's happened in the past 25 years with a little company called Starbucks. They figured out that if they could actually elevate it a whole nother level and create an experience, a coffee drinking experience, if you will, they can get you to pay $4 to $5 now, actually much more. The biggest drinks are like $8 or $9. And look at this, $4 to $5 for what is essentially a few pennies worth of a commodity. That is an example of how our entire economy has progressed from an agricultural one to one that was dominated by manufacturing, to one by the 1950s became dominated by services. And now we see the emergence of experiences as a distinct form of economic value. So value is given to premium offerings. And Logan, I'm going to ask you to talk about this next slide. Why don't you do this one, and let's talk about it in the context of medicine and eye care.
Yeah, and the last slide is titled "That Value of the Premium Offering." We all want to be adding value to our services, adding value to our practices. And the through line into healthcare from all of this, obviously, we're not selling coffee, but when we treat our patients better, and when we add value through interactions that are premium, through branding, through education, we can actually literally increase the value of what we are offering through this sort of ethereal thing called the patient experience. It's not philosophical. It's not an idea. It is a practical, valuable piece. And so on that next slide, as we move up the chain, there is actually, and this is just Joe Pine is just writing the book right now to talk about the transformations as the next and final stage of the progression. And we can see how this in eye care, especially, receiving eye care in all of its ways that we help people is a transformative experience. I think transformations build on experiences, but what this gives us is another window into there is room for us to grow here. Practices that invest in experience design and in training their staff and building technology tools to increase that, there is room here to grow value, financial value, word of mouth value, marketing value, all the things that we all want. And in the end, it's about happier, satisfied patients and more engaged teams.
Absolutely.
So yeah, it's great.
And we know that whenever we customize a service, we've now made it more experiential.
Exactly.
Customize a good. I mean, Dell Computer, they customized the computer. You ordered it special. That was a higher level of value. You're now paying maybe somewhat more for a Dell computer, but you got it configured the way you wanted. The same thing is true when we customize a service. It becomes automatically more experiential. And if we have an experience that is so inherently meaningful and personal and literally changes the person, that's called a transformational experience. That's the highest form of value. And I think eye surgery is, exhibit A for transformation. The problem is we haven't positioned the offering in such a way that doctors and their teams communicate that to the patients. The patient recognizes, wow, patient knows they're seeing great, but the doctor's not taking enough credit. And if we go the other way, we tend to commoditize our services. That's why we saw happen in LASIK when people thought if they lowered the price, more people would have it done. No, doesn't work that way. Doesn't work that way. You don't want to commoditize, you want to customize. And so we've been talking about this thing about experience, and we have a bunch of adjectives here on the screen from Joe Pine and Jim Gilmore, the experience economy authors. These guys are amazingly brilliant. And this is what a great experience looks like, right? It's memorable, it's personal, it is emotionally engaging. It will increase value because you're appealing to what a consumer wants, what a patient wants. It is intentional, it is not accidental. And you know
Mhm.
this because when you go into a fine dining restaurant, when you go into a great hotel and you see how smooth everything runs, they spend a lot of time and a lot of resources training their teams on how to interact with guests and how to respond when something doesn't go according to plan.
Yep.
So with that, Logan, I'm going to hand it off to you to do the next few slides and talk about Promptly, because Promptly is an amazing software suite. But I think this is a setup for you. So please go ahead.
Yeah, and this it starts with, when we were noodling how to frame this whole webinar. Some of the we I mean, I think the stop talking and start doing is like the centerpiece. Like nothing we've said so far is probably foreign to anyone here. We all know what it means to have a great patient. We all want that. Like who doesn't want that? How do you do it? The other component, the other way we talked about it was high tech and high touch. And really, from here, the concept is high technology, great technology can build the space for a high touch, a really great experience, and therefore, great technology is foundational to a great experience. So this is an arrow. I think this is what a lot of people think of for a great experience. Like it's super clean. It's like person goes from A to B to C to D. It's very predictable, super orderly, and we just have to check the boxes off. But in reality, I think that the patient experience looks more like the next slide. It is actually an ecosystem of touch points. Every interaction, every micro interaction our patients have with the practice impacts their experience of our practice, meaning what we write, what we share for education, the emails we send out, the quality of our technology, the scripting that our call center uses, every single interaction of our team and that patient in their fear, in their excitement, in their questions, all of these things sometimes become positive green experiences above the line. Sometimes they're negative experiences below the line. And so the goal of our peer experience design would say on the next slide, how do we?
And Logan, I want to add something to this because
Yeah,
I've
please.
often said that when a patient walks into a practice, they are forming impressions every second or two. If this in
Immediately,
their brain,
yes.
what they see, what they hear, there are impressions being formed. There are perceptions being formed. And much like your line here, I see it's like a stock ticker. If you look at stock tickers and trades, they kind of go up and down like this.
Mm-hmm.
Same thing's happening to patients. And now they're not maybe consciously thinking that way, but stuff is coming at them and they are
Mm-hmm.
forming impressions. And people think, oh, well, we do good customer service. It's not about customer service is one component of this bigger umbrella of their overall experience. And with that, thank you for letting me interject. Please take
No,
over.
And I would
that's
like to add a
yeah,
comment
please.
too. And patients are extremely observant because often they're being asked to wait to see the doctor, to wait while they're dilating. And they're doing what? Looking around. And they notice things that sometimes even the staff or the doctors don't notice, like how clean the office is, how organized the desk surfaces are. If the front desk office, the receptionist has a complete mess at his or her desk, patients are going to notice that. And then they're going to maybe formulate a misconception that maybe the surgeon is not as organized. Do I really want surgery by somebody whose office is this chaotic?
You're absolutely right, and
Yep.
I think doctors and administrators tend to not recognize this or not give it as much weight as it is. I can tell you when I talk to patients in clinic, it is amazing what I learned by just asking them questions, and I learned a lot of good things, and I learned some things
Yeah.
that need to be fixed. But one was sitting in our lounge and said, I really noticed this time you've got better snacks, healthier snacks. I mean, sometimes I'd be like, wow, you give snacks? We don't give snacks. No, but it wasn't just snacks, it was healthier snacks. I think patients notice everything. They don't always tell you. In fact, 94% of the time or so, they won't tell you, 96% of the time. They only complain, only 1 out of 25 patients with a complaint actually complains, which is an interesting data point.
And that human-centered design would tell us, very rarely do we even could we even identify all those moments, all the things that we just said? Doctors certainly focus, as they should, on giving a great medical outcome. That is a vital part of a good experience, but that is not the only thing that shapes the patient's experience. And that's the key thing to pull out, is like, it is literally every touch point, those you control and those you don't, that impact that experience. So what we have to do is build systems of technology and systems of people that will elevate the whole, that we will train and we will build workflows that can optimize as many of those green dots as we can. And there are literally hundreds in every interaction, and eliminate those red dots. So the goal is not think of it as linear and just get one good outcome and we're good to go. It's really thinking about this as a system, and every interaction matters. And so our whole workflow and our whole human element both matter a lot. So I want to talk now, next we're going to talk about, so what are some major areas, major pain points that practices have in building that system, and building the consistency of a system. And the first one is a fragmented experience. Let me kind of explain on the technology side how this looks. Practices were all on paper for a long time, and then they add an EHR, and then they add a PM system, and they probably have an RCM system, and maybe they add in a reminder system, a little bit that does reminders, and maybe there's an online scheduling module, and of course their staff needs to have some eligibility software, maybe a patient cost estimate software, and then you add the payment software in, and pretty soon you have a Franken-Tech of stuff. And we're trying to do the right thing, but what happens is a fragmented experience leads to bad experiences and negative interactions and confused patients, and not only patients that are suffering, but our teams that are suffering with hours of wasted time jumping login, user, password, which APIs connect. I have to pull this report from here and manually edit it over there, like our man here in the photo who's suffering from too many systems and a fragmented experience. And I don't want to, this is where the team experience and the patient experience are aligned. The more we fragment it, the more pain and inconsistency we bring into the system.
And actually,
yeah.
Logan, when the staff is that frustrated because of all the steps that you beautifully outlined, their body language and the way they speak inadvertently with patients or interact with them is reflective of their frustration.
Right.
And patients pick up on that.
They not only do they pick up on it, it is formative. It is formative. The frustration that a staff, it's already stressful enough to work in healthcare. We do important work and it's hard sometimes. Like, why do we allow technology and the fragmentation of that system to make it so hard to deliver care? And that's, you're going to hear that theme over and over, is technology should support and structure the experience so that your team can do great work. And too many times, a fragmented system. So what's the solution? Obviously, consolidation. We see it promptly. Our customers often bring 5, 6, 7, 8 softwares into one. They're able to get rid of the fragmentation and work out of one workflow. And that is not just about a sales pitch. That is a better experience for a team, a smooth, frictionless workflow for the team, everything in one dashboard. And then the patients don't have to jump between 3 or 4 logins and not to know where to expect things and have their payments get lost. When Sharif, when you showed that review earlier on in the presentation, and all the person's comments were like, I tried to log into my portal here and I couldn't get in, and I got a reminder here, but it was a different thing. Like, all of these are undergirding this kind of thing. When we fragment the experience, our we're asking the patient to sacrifice and our team to sacrifice. Not only does consolidation solve for that, practices that go to promptly or just consolidate in general, they can save thousands and thousands of dollars by getting all those systems brought together. So there's a real benefit here. That's pain point number 1. Number 2 is healthcare can feel so impersonal to many patients, and our technology like reinforces that rather than counters that. Um, I am blown away in our industry by the rigidity of the technology that doesn't allow. I mean, there are still technologies out there that have character limits on messages to patients that don't allow you to attach video, that you cannot customize a message to a patient by doctor, by location, by specialty, by appointment type. You can't build really dynamic sequences of education that allow you to customize the tech on the back end so patients get what they need when they need it in a personalized way. And obviously, impersonal communication, we think of the human side. I would argue that the technology side needs to be positioned well and built well to create those customized communication channels. And that's kind of how Promptly has approached it for really meat and potatoes things like managing forms, sending form renewals so patients have updated information. How many of our practices have like old photocopied forms that have been photocopied since 1980 and run through, digitize them? Yeah, go ahead, Sharif.
No, I mean, look, Promptly is an incredible suite of software. It is one thing that just simplifies life. And I've
Yes.
just learned about it. I remember when Anish, the founder, Anish Kapoor, first
Yep.
launched this 3 to 4 years ago. And it was just, it was really around kind of appointment reminders. And he has grown this thing into something that is truly, truly valuable to address these key issues, right? That you
Yep.
talk about, but you've got more. It's only 2 pain points. Should we get
Yeah.
into the others? Should we go to three?
Yes. And these first three are the big three. So we started with consolidation, then we had customization. Now we're on to convenience. We just, in healthcare, we make it too dang hard for patients to work with us. So you can go to the next slide and just, I mean, these are some ways that Promptly has built ways it makes it easier for patients to work with us. Online scheduling, automated wait list reminders, portals, referral portals, digital statements, text to pay, recall reactivation. Think about what happens if you don't have an automated wait list. Just as one example here, a patient wants to see Dr. Matosian for cataract surgery. She's booked out because she's very, very awesome and popular. 3 months out. Now, Dr. Matosian has an opening that a person had canceled. If you don't have an automated wait list that pings patient, that patient has to still wait 3, 4, 5 months, and there's a gap in a schedule. So everyone loses. Everyone loses if you don't use technology to make it convenient for patients to work with you. I know that our scheduling templates are hard. Online scheduling is hard. And sometimes portals can be tricky. If we invest in technology, and I think Promptly's done a great job of this coming from the outside, we make it easy for patients to work with us. We reduce the friction and we make it better.
Well, and we make it the same or similar to what everything else in our life is. We can just pick up our iPhone and order just about anything, right?
That's right.
That's right. Including a car.
That's right. If restaurants can do it and everyone else can do it, we can do online work. And again, it's not because it's a sales pitch. It's a better experience for patients. These last two are really what happens when we don't do these first three. Inconsistency in the experience, that fragmentation, that lack of convenience, that kills trust. And trust is the currency that we thrive on in healthcare. We need patients to trust us. When they trust us, they listen to recommendations. It reduces their fear. And this is not just healthcare, but it certainly includes healthcare. The biggest thing we can offer people is consistency. Think about Disney. Disney has castles, they have characters. What they offer is consistency in the experience, the logistics, the operational side. Starbucks, if you mentioned Starbucks as that premium experience, my daughter will often say, I just love Starbucks because wherever I go, I can get the same consistent drink. When we build systems so our staff can deliver consistently through technology and through training, patients notice and they trust us, and trust is invaluable for that.
Yeah. And it's these little things that help build trust or can break trust, right? And by
That's
the way,
exactly right.
On Starbucks, I mean, they lost their way. It's been well documented, mob scenes and mobile ordering, and they're trying to get back to the basics of this and not have, 10 million versions of drinks. What about this last pain point?
Well, and the pain point is what happens when all these are building, right? When we are busy and fragmented and inconsistent and not customized, we're so busy with the work that we think that we're supposed to be doing that we don't connect with patients. So connection is the last value here. When we can connect with patients, that is what it's all about. And so promptly, our mission is technology to humanize healthcare. And if we can automate and build systems and technology that supports all these workflows to get rid of those manual tasks, then people can do the people stuff. And that is the goal. Is ironically, we're a technology company that wants the focus to be on the people. And that is where our companies work so well together is, so let's say we could build up all of this technology and get it all humming along, automate what can be automated, et cetera. Then there's space for the people. So these next two slides, you can go to our website and check out. We've made this as a journey. This is the patient journey. The next slide is the staff journey. Both of those matter and they layer on top of each other. And if you can invest in technology that's not fragmented, that's customized, and that is convenient for patients, you build this great journey. And from there, the technology has done its part. And then we have this space, this beautiful space for your staff to work with the patients directly. And that is where PX90 comes in.
Well, yeah, and I mean, Pine and Gilmore have said, look, 85% of a patient's experience, customer's experience, is based on the interaction with people.
That's right.
And if we're so buried in the technology because we're overwhelmed by, 7 different logins every morning, if you're a team member,
Yep.
that's just, you don't have enough energy in your day to be nice to people. And Dr. Matosian, as you said, patients notice. Patients notice everything. So where does that?
And actually,
Yeah.
Sharif, what a terrible way to start the day. You're starting it on a negative note,
Yeah.
and then it's downhill from there. So why not start by humanizing the whole process for patients, for staff? And that's
Absolutely.
what Promptly and PX90 do so well together. It's like peanut butter and jelly. They're inseparable, and you got to get them both.
They do, and I at the encouragement, I wrote a column in Cataract and Refractive Surgery Today for 8 years straight. I wrote a column, and then I was a section editor for them, and it was all around customer service and customer experience in medical environments. Well, with the encouragement of doctors like Sandy Feldman and John Talamo, who said, "Sharif, you got to write a book." Well, 2020, my book finally came out, which really said, "Look, being nice is important, but it's not enough. You've got to go beyond. You can't just rely on bedside manner." That was the title of that book. Dr. Tristan, I remember you read it at the time, and then
I did.
Yeah.
Actually, I've read both books. I read the Beyond Bedside Manner when it first came out. And then I went through the entire PX90 protocol. I read the book and followed the various instructions, exercises that you recommended, Sharif, for staff and for the practice to do. It is so unbelievably helpful. You can pace it at whatever seems right for you at the practice helm. You can delegate what you feel is appropriate. And trust me, the 90 stands for 90 days. After 3 months, you're going to come out a stellar, different practice than the way you started.
And that's what we're hearing it from customers. And I'm passionate about this topic of patient experience because I believe it is the reason why we're only seeing 20% conversion to a premium implant in cataract surgery, or 600,000 eyes and declining when we peaked at 1.4 million. We really should be 5 to 6 million a year. Easy. I think it's not because of outcomes. And it's not because of price. It's because the experience is lacking. It's failing to meet the expectations. And the book was really about kind of the philosophy, the why patient experience is so important. And PX90 has now taken all that and created a methodology that everyone in a medical practice can look at, can review. And I want to I think this 90-second video is a better way of explaining it than me.
PX90 is for practices who understand the importance of the patient experience, but aren't sure where to start. PX90 gives the structure you need to make amazing patient experience a reality. Through 12 strategic workouts, PX90 takes you on a journey to redefine your practice, starting with your core purpose and ending with a team-driven experience that turns every patient touchpoint into a story worth sharing. Complete PX90 as a 90-day sprint, 1 workout per week, or spread it out with monthly workouts and finish in a year. You'll start with a warm-up to spark new thinking, move into focused exercises with your team, and wrap up with a cool down that keeps progress going. Each video guides you through the workout, with pauses to reflect, engage, and apply what you learned. As you work through each exercise, you'll build a customized playbook that captures your team's progress, 1 step at a time. Inside, you'll find 12 core workouts, plus an intro and onboarding session. It's packed with practical tools, clear takeaways, and step-by-step actions, all designed for busy medical teams ready to grow. Practices large and small from all over the world are making meaningful strides in patient satisfaction and team engagement. PX90 isn't just about improving systems. It's about leveling up as professionals and creating a stronger, more human healthcare experience.
See, I believe make sure I get to the next slide. Okay, there we go. I believe that we have an obligation to our patients, not just the ones that are paying us top dollar for elective procedures, but all our patients deserve a better experience. Going to the doctor should not be this terrible, awful thing. It doesn't need to be. And so, Dr. Tosin, you said it earlier, right? I mean, I can't, there isn't enough of me to go around. So we figured out the best way with my team is we put my knowledge into an online course that doctors and their teams can access at their own pace, which is great. And it's literally, once you log in, you choose a workout, you open the playbook. We have a physical playbook that every member gets. You watch the video while you're doing the exercises. And this is basically, each one is roughly an hour. The video's not an hour, but the work. And what we're seeing, different practices are telling me, some like to have individuals do it and then come together to discuss. Some do it together as a team. There's really different ways to approach it, but we wanted to make it easy for people to access and also understand. And we're finding that it works. And this case study that came out last month from one of our early customers was incredible. 180 employees at 18 locations across Malaysia. They're Malaysia's largest refractive practice. And their CEO told me that this PX90 gave them the springboard and the structure to go about it. I think everyone wants to do a better experience, but people don't know where to start. And with that,
or what they do, Sharif, is they approach it in a very scattered way, so there's no cohesive outcome.
Right. And now you can form a common language so that when, an administrator says, hey, we've got to work on eliminating more of our negative cues, everyone understands what a negative cue is. Or, hey, you know what? Let's work on a new signature moment for the post-op day 1. Everyone knows now what a signature moment is. It's getting everyone on the same page, and it's working. It's working. The results are great. The feedback I'm getting from customers are great. And it really illustrates this point that Logan and I thought was so important, because people say, oh, isn't experience just really good service, right? They did really good at customer service. And no, because if you think of services are activities. It's what you do. And it is very hard to be unique in eye care, because in any given city, there are a lot of people that do eye exams or that do cataract surgery. Experience is how you do what you do. And it is in the experience that you have an opportunity to differentiate your services, to customize and elevate your services into experiences, because that's what people remember, and that's what they'll go and talk to people about. And that's what you want. Ultimately, you want to spend zero on advertising because the word of mouth is so strong. Pick it up.
And actually, that's what will help you differentiate your practice and yourself from your competitors, because the patients will love that experience, and that will have that positive ripple effect of additional referrals, 5-star reviews, and on and on.
Well documented across pretty much every industry, and now it's time for healthcare to catch up. So, Logan, talk about this slide about the team.
Well, this is we thought it was important to be super straightforward and say, if you want a great patient experience, number 1 with the bullet is invest in your team, invest in your workflow, because a great patient experience is not magic. It's not luck. And it's not that one time you did one really cool thing. It always begins with an overall great team experience and a great technology workflow. And when you bring those two things together, you uplift all those touch points. It will exponentially expand the impact that you have. And I think what you said earlier, Sharif, like this is not just about your most premium patient. This is your whole patient base, every patient that you see, and it's your whole team. And man, life gets better for practices when every patient is having great experiences because every team member is engaged and happy. And we can support that. It's not luck. We can support that through this high technology and high touch training that brings that whole experience up. Yep.
Together. And I got this little video. I just need to show you. This is a 5-second video. This is from Buena Vista Eye Care in El Paso, Texas. Dr. Monica Ramirez, her husband's the eye surgeon, and she runs the practice. And she said, Sharif, I've been talking about this stuff for a long time because I really believe in it. But when they hear a different voice, when they hear you on the video and they see the exercises, it brings it to life for our team. This is the huddle after they finish their PX90 session today.
1, 2, 3.
Boom. I love that. I love that. And I have customers sending me videos like this of what they're doing before and after, physical changes they're making to the physical environment, as well as getting people on board by having them involved instead of telling them what to do. Let them be part of the process of inventing and coming up with what the patient experience could be like inside your practice. And I do believe these two tools complement each other beautifully. Logan, you did such a nice job talking about how we can get all that mundane technology. Let's get it. First of all, let's consolidate into one thing and let's automate it so we remove that burden off the shoulders of not just the administrator, but everyone who's touching a computer, right? So they have more space, emotional space and time to be able to interact with patients. And what PX90 offers is that real training and grounding for the culture to come together and coalesce, because patient experience is everyone's responsibility. Even if you're in the billing department, if you're a technician, it doesn't matter. Everyone has a piece of making the patient experience better, for sure. And we have this.
Actually, let me just jump in. Improving and implementing the Promptly and the PX90 combo really helps the bottom line of a practice, because not only will there be more referrals, but those, let's say, open slots because of cancellations now are going to get filled, perhaps with a surgical consult, which then will generate more income. So the ripple effect, again, is very healthy, not just for the culture, not just for the team, the patients, but also for the bottom line.
It's very rare in life that we see things that come out that have this kind of, like, it's not just win-win. It's win for the doctor. Oh, well, it's win for the patient. First of all, patient has a better experience. It's win for the doctor because the doctor finds more joy in their chosen profession. It's win for all the team members because they're now more engaged and we've removed some of the burden, a lot of the burden, so they can actually, get closer. This is what I've heard from customers that are telling me, like, PX90 allows them to really tap into the why they're there in the first place. I love that. It's great for the practice financials because practices will do better on all the key metrics. And it's even, it's great for the industry because there's more product pull through of their premium offerings. And I'd say it's great for society because patients who have a better medical experience, and this is not just for ophthalmology, it's PX90 and Promptly's and other specialties as well. We need to see all of healthcare transform and get better. But it starts here. It starts with the people who are so kind to give us 35 to 40 minutes of their time this evening, and if they're watching it on replay. And we want you to get involved and talk about the Promptly offer that the GPO members get, Logan, because it's pretty darn good.
Yeah, we have a great relationship with GP Ophtho, and it's just a really, really generous license discount per provider. So if you want, if a person wants to see more, I'm here mostly because I'm very passionate about patient experience, but man, Promptly delivers exceptional value in a lot of ways. So if get a demo and and what we'll be able to do is price this out for you at a rate we give nowhere else, this GP Optho preferred pricing. So.
Yeah, and on PX90, we price this thing for 10 licenses and the playbooks, so it's a practice. A doctor, administrator, and team members at $3,500. There's 15% less for the GP Optho members. And that's really, $3,500 or $3,000 is basically one new patient who said yes, right, to a premium procedure. And we did this intentionally because we want this to spread out. We want all ophthalmology practices to take this seriously and to do this. And I've decided to also throw in a little kicker for this. I'm going to give an hour of customized coaching of my time. And Dr. Matosia knows how expensive my time can be. I'm going to give an hour to help you either on the front end, kick off the program with your team, or on the back end, evaluate where you go next. We do that via Zoom. But if you want that, you need to sign up by June 30th. I can't make that a forever. But if you sign up by June 30th, we'll see it come in. From the GP Optho website, there's a link to a special landing page that you sign up, and we'll see, and we'll get in touch with you on that. But these two together are very, very powerful. And if you are sitting there thinking, yes, this is something we want to do, we encourage you, get involved, get the demo promptly, sign up for PX90, and you will look back 3, 6, 9, 12 months from now and you go, wow, I can't believe how different things here and how much better it is for our team, for our patients, and for the health of our practice.
Mm-hmm.
That was excellent. Sharif and Logan, you guys knocked it out of the park. What an incredible presentation, full of so much information. And this is just the tip of the iceberg. If you open the book and implement promptly, I mean, it's so much more than what we have time to discuss in this program. But we have one question. One of the early slides showed that 80% of CEOs, when they were surveyed, said that they provided excellent customer service to their customers, yet only 8% of their customers said they did.
Yeah.
I'm going to ask the same question to each of you, Logan and Sharif. What do you think is the cause of this big disconnect?
Logan, you want to go first?
Sure. I think, and we'll speak of the healthcare environment here.
Yes.
Doctors, but man, even when I was in a leadership in a practice, the simple fact is I didn't have a complete pulse on every touch point and all the pain we were causing customers. Doctors tend to think about the medical outcome, and admins tend to think about, did they get them through that very linear experience successfully? And not about all of the customer sacrifice that we put on them, all those micro interactions, every script, every tool, every technology. A lot of doctors don't know all the technologies that they're using and how they're impacting care. Not the medical outcome care, but like the pre-care, all those communication pieces. So I think it's certainly not intent. I think doctors and CEOs want that to be a great patient experience. I think the gap is in not knowing where all those green or red dots are and how all those interactions are shaping things.
Yeah. I think actually science knows this. It's cognitive bias, right? We as human beings tend to inflate our own sense of how good we are.
Yep.
In our own minds relative to how others see us. And I'm not really talking personal relationships, maybe it's there too, but I think business relationships about how good our offering is or how much people value it. And we see it all the time. I see founder CEOs say, hey, I'm going to build it and everyone's going to buy it. And guess what? Not everyone bought it. Why? Because you didn't recognize some things. And this gap is so large between the leader's perception and the customer's perception that it needs to be addressed. And there are ways to address it. And I think, the technology and the tools we talked about tonight really help close and address that gap. But it's cognitive bias, Dr. Matosian, and it's no more complicated than that. We think we're pretty good.
And the solution is right here. The Promptly software and the PX90 training tool. Together, they really help, I would say, shrink this incredible disparity between perception of how well we're running our practices versus reality of what patients are really saying about the practice.
Yeah. These are small investments that can pay big dividends. It does require time and commitment. You've got to do the work, right? And even
Yeah.
Logan and I were talking offline about someone that gets both of them. We think, great, get both of them, do promptly, and don't start PX90 until you've got promptly 90 days in. You've got that well locked and loaded, or you get overwhelmed. We don't want to overwhelm. The only people we want to overwhelm is our patient with delight. That's the only
That's right.
that we want to overwhelm.
Well, that's a great way to end our webinar tonight.